Namaste guys. Today we are gonna understand what is exposure response prevention therapy for obsessive compulsive disorder OCD. Exposure response prevention is considered the gold standard for therapy in OCD. So exposure response prevention, as the name suggests, is that you are exposed to your obsessive thoughts and anxiety, but you prevent the response, that is you prevent compulsion. So for example, if you have contamination OCD, then you will by yourself, okay, go and touch something which is dirty, or if you consider, for example, your phone is dirty, you will touch the phone, and then you will reject the urge to do the compulsion. Maybe your compulsion is to wash your hands, or for example, if you have harm OCD, so you will think those harm thoughts by yourself, okay. You will force your mind to think those thoughts of harm thoughts, and then you will not do the compulsion. Your compulsion may be external or internal. Internal compulsion may be that you may be rationalizing. Rationalizing means that you will be arguing with yourself that no, I am not a bad person, I may be having such thoughts, but I will not harm anyone, I am like I like everyone. So you will rationalize with yourself. You will say that you will not try to ignore these thoughts, but you will argue with these thoughts, right? Then for example, if you have homosexual OCD and you get thoughts for like gay thoughts for homosexual thoughts, then you will you will rationalize with yourself, no, I have had sex with girls, so I am not gay. So you will do these compulsions. But in ERP therapy, the thing is that you don't have to do compulsions. You think of those thoughts, okay, you think of those thoughts by yourself, and then you will stop yourself from doing compulsions. You will face the anxiety. So that is like step by step you have to do. So for example, if a person who is afraid to go into the lift, the thing is that the doctor may say that first you see the photo of a lift and you feel the anxiety. He will have some anxiety, and then he will, but the thing is that with time that anxiety will go down. In the second step, the person may go inside a lift, but he may not close the lift, and he may not he may just stand there with the lift's gate wide open. So the thing is that he is habituating himself, he is habituating with these things, and his anxiety is going down. Basically the funda is that the thing that does not kill you only makes you stronger. It means that when you face the fear, it is not that the fear, the thing that you are afraid of, it will become smaller, but the thing is that you will become stronger. So that there may be germs on your phone, or there may be those thoughts of harm coming, but the thing is that you become stronger. You become stronger, and you face the anxiety that comes with it. Mostly the thing is that these thoughts have anxiety associated with them, and that is why it is creating a problem with you. But for example, think that you are a pink elephant. I am saying this thought and you think of this thought, is it creating anxiety? Mostly it will not create an anxiety, and you will not do any compulsion, but those thoughts are having anxiety associated with them, and because of that you are doing compulsion. So the thing is that you will have to learn to face the anxiety. I'll tell you, for example, how I do ERP. For example, I'll consider that this spoon has germs, and I will touch the spoon. See, okay, I'm touching the spoon, and then I will just sit. My urge is going that my urge is there that I'll go and wash my hands, but I am not washing my hands. I am just sitting here. So you have to face that urge. So how does anxiety come in our body? It comes in the form of sensations, body sensations, as in, for example, your neck, you are like this throat may feel dry, your chest may feel tight, you may have cold sensations on your hand, sweating on your head, in your face. So the thing is that you are afraid of those sensations, but in ERP we are taught that you need to, when these thoughts come and the anxiety comes, instead of focusing on these thoughts and instead of doing compulsion, you need to focus on these sensations, and you need to accept those sensations. So the thing is that there is when you accept these sensations, the anxiety comes down. When these thoughts come, for example, when these obsessive thoughts come, the anxiety shoots up. Okay, it shoots up like this, but then slowly, if you don't do compulsion, it will go down. If you do compulsion, as in like the cycle of OCD, thoughts come, then anxiety comes, then you do compulsion, there is a temporary relief, but again those thoughts come. But if you want to break that circle, if you want to come out of that circle, then you will have to break the circle of anxiety. Okay, so you need to basically face the anxiety and not do compulsion. You will have to face the sensations of the anxiety. The thing is that in ERP there is something called SUDS scale, subjective unit of distress scale. It shows that for example, if you have contamination OCD for like 10-12 years, and I will tell you that you touch something and now don't do compulsion, you will say what mad fellow he is. You cannot do that. But with time and also you'll have to take small steps. For example, the first step could be that instead of like touching the phone, you just look at the phone, it has germs. You may have the urge to do compulsion, but you will face the anxiety, and that anxiety would be a lower level. What my point is that you'll have to face anxiety step by step. First you face a smaller anxiety, then a bigger anxiety, and step by step you face an anxiety. For example, if you want a person to play international cricket for India, then he'll have to play school cricket, then he has to play district, then he goes to state level, then Ranji, and then he goes to international, right? Nobody goes straight to international level. So that is how you need to train yourself. You need to so the thing is that the world is full of dangers, right? These things, for example, when a new mother will think that this world is very dangerous for my child, but that child grows, right? That child becomes an adult. It is not that the dangers are going down, but the thing is that the child is becoming from a baby to an adult, and he is becoming bigger, and he is becoming stronger, and he is able to face the challenges. So that is what you have to do. You'll have to become stronger, and by stronger I mean that you'll have to face your thoughts. In OCD, you are basically afraid of your thoughts. These are the thoughts that come in your mind. You are afraid of. So in contamination OCD, it could be that you see something and then your thoughts come. Sometimes, for example, harm OCD or homosexual OCD, you don't have to go outside and meet men. Okay, in homosexual OCD, to do the compulsion, you may sit in your head, like sit in your house, and you think of thoughts. Okay, I may be gay, or you look at a picture of a man, handsome man, and you will get thoughts of homosexual OCD, homosexual, and you may feel that okay, I am gay, but then you face those thoughts. You do not do the compulsion. With time, you will those feelings of anxiety will subside, will reduce. That is my promise. That is how I have done it. I have done this, and that is why I am telling you. I connect with you. I understand what are you going through. That is why I am telling you that these things work. Okay, I know that this sounds very painful, but the thing is that डर के आगे जीत है, as we say in Hindi, that beyond fear, okay, there is victory. So you have to face the fear. If India wants to win the World Cup, it has to play and it has to win, right? It cannot like just sit at home and say, give me the World Cup. The World Cup is happening in India, so you should I should get the World Cup. It does not happen like that. You have to expose yourself to these thoughts yourself. If these thoughts don't come, still you do it. So for example, I used to sit for like 20-25 minutes in the morning after my exercise and meditation. I used to sit for 20 minutes and think of these thoughts, make myself very anxious, and then not do compulsion, face the anxiety. So that is how you will have to also do it, right? So step by step you'll have to do it. Step by step you'll have to increase your anxiety. If you understand Hindi, I have made more videos on Hindi in this, but for English, this is the video, and this is the video you will understand that you will have to slowly face your thoughts. See, the thing is that you'll have to think of those thoughts by yourself. For example, if you have any OCD, for example, sensory motor OCD, you think of yourself, okay, I may stare at someone. You think of this thought, and that thought will bring anxiety, and you face that anxiety. So, or again, you may have rabies OCD. You think of that dog will cut me and I will have rabies. Face the anxiety. Okay, so the thing is that these thoughts and these things will keep on coming. You cannot protect yourself from these things. When you go out, when these things come, these thoughts will come to you. You have to become stronger. Things will not become safer, world will not become safer. Look at us now. Also now at this point of time also, we like Israel and Palestine war is going on. War can happen anytime, things can happen anytime. You can lose your job, anything can happen. You have to become stronger mentally and physically both. So this exposure response prevention is like a chance for you to become mentally strong. Face the anxiety. It could also be that you are giving a presentation and you are feeling anxious. Even if you don't have OCD, then just accept that anxiety and keep on doing what you are doing. See, the thing is that for ERP you may have to park some time and do ERP, but for example, if you if you are doing something, right, and then these anxiety comes again, you need to just focus on what you are doing as of now at that moment. For example, if you are working or if you are giving an exam and these thoughts come, harm OCD thoughts come and they create anxiety, you just shift your focus from that anxiety, that anxious thoughts to your exam. Now you will say how to do that. For that you need to watch my acceptance and commitment therapy video, in which also I have made in English. I will put it on the link above, and also I'll put it in the description box. You also need to watch that. So if you do ACT therapy, acceptance and commitment therapy, and exposure response prevention therapy together, your OCD will go away. It will go away. It's a promise. Okay, so I hope you understood what is exposure response prevention. Do it well. In 1-2 months you will, if you do it every day for 20-25 minutes. Therapists say that you need to do it for 45 minutes. I have done it for 20-25 minutes every day. Do it religiously, you will see results. Okay, thanks for watching my video, and in life never give up, keep fighting.